Hi everyone, I'm Simon Erickson here with our special guest star this month, Dana Abramovitz, who is the healthcare programmer of South by Southwest 2017, also an expert in the healthcare industry. Dana, thanks very much for joining us for this month's Explorer mission.
Oh, you're very welcome. It's an honor, thank you.
You know, at the 10,000 foot level, we heard this morning J&J and IBM CEOs both talking about devices and systems joining the healthcare industry. And there's a lot more gadgets and a lot more data going into healthcare these days. I wanted to talk about a few of those. The first maybe being wearable devices. We're seeing companies like Fitbit that are connecting devices to consumers and people. What is this allowing for in the healthcare industry?
Well, one of the big things that I'm really excited about is patients being involved in their healthcare. Having a wearable just really means that patients can be an active participant in their health and in their health care. And they can monitor their steps, they can monitor what they eat, they can monitor how they sleep and how they're feeling. And we have all of that information, and it just is becoming just accessible. And that's what's really important, I think.
And is it fair to say patients are becoming more interested in their own health these days because they have devices that can do that?
Oh, of course. We've seen in banking and even our cars, just having access to technology. Patients are really consumers, and we need to think of them that way. And giving them that voice by letting them have a presence in their care through those devices, I think is just going to grow.
Speaking of that, a lot more digital data now, and we've started talking about electronic healthcare records, where you've got companies like Athena Health or Cerner or Epic Systems that are actually managing patients' data in the cloud, and it's much more today than it was several years ago.
Yeah.
How do you see this being adopted, and where is this going in the next couple of years?
Well, I think that, first of all of these cloud systems, are all HIPAA compliant and secure, so we really don't have to, I don't think, worry about that. And, I'm going to leave the experts, leave that expertise to the experts, and I do believe those cloud systems know what they're doing, and we can totally trust them. So we can focus on what we need to focus on. And I also think that hospitals don't want to have the capital expenses of having servers in order to have all of that data. So it just makes sense to see that shift to the cloud.
And are people becoming more and more comfortable, do you feel, with providing healthcare data for an electronic healthcare record or for something that would be put in the cloud? Are we seeing that fear go away?
Well, I mean, it's funny. I see so many people posting things on Facebook and on Twitter and just on social media, sharing their information, and we've seen that shift such that people are benefiting from sharing that information. Communities are being built. People are getting help for problems that they thought they were all alone. And it's actually useful to get that information. And so I do think that as we're sharing so much information, more and more people are becoming comfortable sharing that data, especially if you're sharing it to a private health record that your care teams need to access in order to provide you better care. So I do think that patients are embracing that, or at least starting to embrace it more.
One of the beautiful things about the healthcare industry is that every consumer is different. We all have different fingerprints, and I know a topic you're very passionate about is genomic sequencing. We all have different DNA, which makes every individual patient different when they're going to the doctor's office. Companies like Illumina are now really bringing the cost of sequencing a whole human genome down significantly. What does this mean in the longer term of healthcare?
So you're right. This is something that I am really excited about, and if we can identify our sequence, we can, there are all sorts of other components to it, and just because you have a particular variant doesn't necessarily mean that you're going to develop a disease, but it's knowledge, it's information, and what people can choose to do with that. And so, I mean, I want my genome sequenced. I'm so curious to know what's going on. And I think it's just, just useful information and how we can start utilizing that information and really personalizing medicine. And not necessarily medicine, but life, our nutrition, our exercise. There's all of that as well as we learn more. So genomics is definitely a really great way for just people to understand themselves.
And also, you were saying earlier, I believe, about pharmaceutical companies that really have a benefit from seeing genomes, know how to work on certain diseases and treat those. Is that fair to say too?
Well, definitely. I mean, so one of the things, we talk about cancer, right? I mean, it's really a genetic disease. It takes place at the genome level. And you might have a tumor that's associated with a particular tissue, but it may behave like a tumor from a different tissue based on its molecular infrastructure. So how do you find the right treatment? Not every breast cancer is the same. Not every lung cancer is the same. So actually the National Cancer Institute is doing work to actually identify the right drug for the right tumor. And if the pharmaceutical industry can follow suit, then sure, the transition from large blockbuster drugs that work for everybody is going to be gone, because it's going to be more personal. But you're going to be able to reduce the cost of discovery and of clinical trials if you find the right treatment for the right patients. So, and then it becomes a fun data technology problem to find, those matches. But there are already companies that are doing that.
So we've got the potential for consumers to be more empowered, know more about their own health, become a larger stakeholder in it. We've got this unlocking more opportunities through genome sequencing and electronic healthcare records, but the system as of today is still largely based off of fee schedules, right? Reimbursement for procedures or tests that are done, but we're starting to see a little bit of kind of value-based pricing, based on behaviors or outcomes, rather than just strictly those procedures or those reimbursements. How important is this for the era of personalized medicine to change the way that the system pays for healthcare?
It's so important, because now we're getting patients' input into their care, into how they value their outcome. You might have a hip replacement, but if you can't do the things and the activities that you love, then that procedure wasn't successful. And so again, the patient's voice being part of that conversation, and making sure that we understand the costs and can control the costs and know what things cost. You'd be surprised how many people in the healthcare system and that are working with patients don't know how much a test costs, but they order it all the time. Is that really necessary? And going back to all the things that we've been talking about in the last few minutes, if you have the information in the health records, if you have information that you're sourcing from the patients directly through their wearables, if you have sequence data to understand that underlying thing, you have this big picture. And now you can use all of that information to understand the cost and the value that you're getting from it, and it really becomes an economic benefit.
And are we starting to see payers and insurers actually start adopting those different payment models now?
Oh, definitely. It's beneficial for them if patients are focused on their health and the value of that, and can start further upstream when it's less expensive. So the payers and the insurers definitely want value-based care, and it transitioning before the expensive procedures have to happen.
Great. Thanks very much for joining us this month, Dana.
You are very welcome. Thank you.
Thanks for tuning in at South by Southwest in Austin, Texas, here in 2017. Until next month, Fool on.